am student nurse Shaker Balisa, BS and 2A student from Bicol University, Tabaco campus. For today's video, I will be demonstrating about bag technique. But before we start, let us tackle first what bag technique is. So basically, bag technique is a tool which a nurse is done or perform during his or her home visit, and thus enables him or her to perform nursing procedures to ease and deafness, to save the time, to save effort, with the end view of rendering effective nursing care to the clients. So upon arriving in the client's home, make sure to greet and introduce yourself to the family, then assess the client's need, establish rapport with the family member to establish cooperation. Also, we have to identify the client and explain the procedure to be done. After that, the client health history also, we're going to check that or get that. Then ask the client to follow our instructions. Good day, ma'am. Good afternoon po. So, I am student nurse Shaker Balisa from Bicol University, Tabaco campus. So, right now, I am doing home visit to your community. And I am here to perform wound dressing. Is that okay for you, ma'am? Okay. So, for the first procedure is upon arriving at the client's house, we have to place the bag on the table or any flat surface. So, we are going to ask the family or the client if they have a table. So we have here our table to serve as a flat surface. But if the clients or the family doesn't have any flat surface, ask for anything like box or anything that you can easily perform your procedures. So we are going to get our paper lining. So we have here a paper lining, Manila paper, then clean side out. The next is we are going to get our plastic lining. So just like the paper lining, clean side out. This procedure is necessary to make sure that we are not getting any contamination. Okay, then place it on the table. Then after that, we are going to put the bag's handle on the table or put the bag on the corner of the table, and make sure that the bag's handle is or strap is beneath the bag. So now we are already done putting a paper lining and plastic lining on our flat surface. Next is we are going to ask the client or the family members for a basin of water and a glass of water if faucet is not available. And if this is necessary, place this outside of the working area to be used for hand washing and to avoid our field from getting wet. Now we are going to open our bags and take towel, soap dish, and our apron, and then we are going to place these articles on the side of our table. So we have here our apron. And here our soap. This is preparing us for the hand washing. So now we are going to do our hand washing. We are going to wipe or dry with towels. Then we're going to leave the plastic wrappers on the towel and the soap dish in the bag. So hand washing is necessary to prevent possible contamination or infection to the care provider and to the client as well. So now we are done with the hand washing. So I will put this back on our bag. So now we are going to put our apron right side out and wrong side with the crease touching the body. So when doing this, we have to follow the proper technique, approach if necessary to protect the nurse's uniform or the care provider's uniform. Then sliding the head with the neck strap neatly and the straps at the back. So this is necessary to protect the nurse's uniform from any stains or formulas or anything that will ruin the aesthetic appearance or approach of our uniform. For the 7th procedure, we are going to put out the things that we needed for the specific procedure. Then we are going to place it at the corner of the areas. This is for us to access easily the materials that we are going to use. So I'll be taking out now the materials or things that I'll be needing. So now I'll be doing a wound dressing. So I have here cotton balls. So now we already put out the materials or the things that we are going to use in our procedure. Then place waste bag outside the working area. So this is necessary to prevent contamination of our clean area. Then close the bag. So closing the bag prevents contamination of the clean area as well. So now we are going to proceed to the specific nursing care or treatment. So now I will be doing the wound dressing for my patient. So I'm already done removing the wound dressing on my client. So we're going to inspect the wound and report to the doctor if we observe redness, blood, swelling, wound separation, maceration, and unnecessary smell of the wound. So now we are going to get our twister and get our small gauze. So these are small gauze. So now we are going to do wound cleansing first by applying betadine or any cleansing solution. So we are going to follow the proper technique from top to bottom. Then make sure that we're going to discard it. Then use one gauze at a time. Top to bottom. Discard. Last is top to bottom. So take note that one stroke per cleansing only, okay? After that, we're going to remove gloves and discard it. And do hand sanitation. So we have here our large gauze. Get the large gauze. Then do hand sanitation. So now get the larger gauze. And we have to place it diagonally center of the wound. So these are wounds, so put it this diagonally center of the wound. Then make sure to secure it using a plastic adhesive tape. So I'm done, ma'am. So after doing the procedures, we are going to clean the materials that we used a while ago by alcoholizing it. So we have here our cotton balls. This is to prevent infections for the next client and to protect the nurse from getting infected or contaminations. So by the way, I'm using 70% alcohol solution. And place it on the clean side of the table or of the flat surface. So this cotton balls that we use is can be disposed on a paper bag and discarded. After cleaning our materials or the things that we use, we are going to perform again hand washing. So I'm already done doing my hand washing. So now, by the way, if you can't do hand washing, at least have an alcohol for your hand sanitations. After that, we are going to open our bag and put back all the articles in their proper places. Now we are going to remove our apron or the groom folding away from our body with soiled side folded inwards. And the clean side out. So we're going to follow the proper technique as well. Not only in putting it in our uniform, okay? Then we are going to place in the bag. And after that, we are going to fold the linen or the plastic linen, clean and place it in the bag, and making sure that we are doing the right technique. As well as our paper lining, we're going to fold it with following the right technique. Then put it back on our bag. So after that, we're going to make post-visit conference on the matters relevant to the healthcare. So we are going to take anecdotal notes preparing to the final reporting. So this is to be used on the reference for future visit or future home visiting. So after that, we are going to make appointments for the next visits, either home or clinical visits. So this is also taking notes of the date, the time, and the purpose. This is also used, or this is also for the following healthcare or the following future visit.